us for the fifth time. So, special welcome to you, sir. But before we start with the session, I just want to quickly introduce Dr. Chhavi to all of you. Right. So Dr. Chhavi is our Chief Medical Officer here at Besugarfit. She has over 27 years of experience as a physician, and she's been treating patients with chronic lifestyle diseases like diabetes, hypertension, cholesterol for a long time now, right? And she's been training, in the US, and also she's been practicing there in California, but now she's here in Bangalore, to help us all also, reverse diabetes. So she basically believes in reversing diabetes and all lifestyle diseases in order to basically reduce their complications to various organs like your kidneys, your heart, and liver, everything through a non-medical approach. Right. And she also has her very own special 6 steps of daily living, which she will be sharing with all of you today. And these 6 steps have also been a cornerstone for Besugarfit's approach as well. Right. And in this program, which is India Talks with Dr. Chhavi, she'll be here to answer your questions, clarify your doubts, and also show you a glimpse of the path back from diabetes. So as you all know, this session happens every single Tuesday at 6:30. So in case your questions do not get answered today, you will still benefit from her expertise, and you can join in early the next time and put your questions on the chat. So over to you, ma'am. Is there anything you would like to say before we start?
Yes, welcome everyone, and I'm glad that you guys have found time on your busy evening to join the session. So I know, Shifa, thank you very much for the introduction, but well, I am a doctor and I'm a physician and who's worked for over 27 years. And I have realized, as I always tell everybody, is that I've realized that I keep increasing medications for people who start thinking that their disease like blood pressure, cholesterol, diabetes, it will get better with medication. So there's this belief that medicine will cure me. And these are lifestyle disorders. They come from actually our years of our habits. Sometimes they come from genetics also, but you can change your genetics if your lifestyle is different from your parent who had the disease. So what I always tell people is that I've realized that if people don't change or realize or internalize or work on their own system, they will keep going, however good a doctor is, with worse numbers. It could be BP, it could be cholesterol, it could be sugar. And the doctor has no choice but to save your body from the complication of that number to be writing medications. And I am also one of those doctors. I will not put you at risk. I don't take drastic measures. I want to make it very clear that if people think that I have some magic wand that they will work with me and I don't have to give them any medication, I actually assess you completely. And if your body is at risk from the level of sugars that you have, or at risk from the level of BP you have, initially till you get into a habit of developing a great lifestyle, I will not let your organs be exposed to high sugars or high blood pressure or high cholesterol. I am a doctor, initially want you to take some medication so that those numbers come in control. In the meantime, you work on your lifestyle. When your lifestyle is mastered, I enjoy taking you off those medicines because my goal is to get you off those medicines. But I cannot, if people expect, if you come to me with a A1C or glycosylated hemoglobin of 9%, and if you say that from day one, certain patients do not agree, they want to do lifestyle, I will educate you that if this number is above 8%, you are harming your vital organs. We need to lower this initially. And then once your lifestyle is very good, you can get on off all the medicines that you're on. There was a question while I was reading on chat, and I'm sort of answering that question right now. So everybody needs to understand that this program is about learning about your own self, about your body, about the diseases that are afflicted in the body by lifestyle, various questions on metabolism, liver, kidney, heart, sugar are addressed on this program. I will request you not to put your direct one single number like my A1C is this, what should I do? I will not have an answer because I don't know you as a person. I don't know what complications you have. I would never suggest a medication on a webinar. So this is to learn about ourselves and how we all can get rid of our medications, provided we understand our bodies, provided we understand our metabolism, provided we understand what we can do for ourselves to get off the medications. But with that, Shifa, let's start.
So the first question is by Mr. Subhashit, ma'am. So he's basically he's saying in one of the videos, you had said that if you have an intake of sugary foods, you can start working towards getting it right the very next day. Can some more inputs be expected? What exactly is to be done?
Subhashi, as I understand your question, if a person was to check their sugars every day, they are accountable for the sugar level that comes at fasting on that day. So what I meant was that if suppose a day before you had, you went to a wedding, you had desserts and thoda sa snack bhi ho gaya, samosa bhi ho gaya. Next morning, you're fasting, which if you really want to reverse or work on your metabolism, you are supposed to check in the morning. So you check at fasting. And suppose your sugars, which were coming at 110, is now 140. That particular day, you can look at your diet, make it more fibrous, more proteinaceous, sprouts or salads or minimum carb. You double your exercise on that day and you make sure you sleep on time. I promise you that your sugar next morning will be much better than 140. But if you were not to check your sugars for the next 3 or 4 days, there is nothing that will tell you not to eat something wrong in the wedding the next day. Nothing is going to tell you that you need to exercise more to burn what you ate yesterday. And at the end of the 4th day, you might be 160 fasting. So it's very important that when you eat sweet or sugar-rated food, your next day or the next meal activity should be totally different. You should know very well how to control your calories, how to increase the fiber, how to increase protein, not to have rice and roti in the next meal, maybe even fast. If your doctor allows, there's no need to eat for a meal. You can easily let your body sort of get into a good pattern. Now, I'm not talking about people with insulin or on 3 or 4 diabetes drugs. But if you're not on 3 or 4 diabetes drugs and you don't take insulin, go ahead. If you had a bad meal, think about next meal. Maybe I can just have salads and live. Not the next meal also chapati, rice, the same thing coming the next meal. Body can't manage that. I think that's what I was talking in my talk, if I'm right.
Got it, ma'am. Thank you so much. So there's another question, right, which is by Mr. Paul, right? So he's asking why are his fasting sugars always more than 100? He notices that only after fasting of 9 hours, it comes down.
So then you need to fast 9 hours. There's nothing wrong. I think people should only eat 12 hours and should fast 12 hours every single day of their life. I tell people all around me, whoever knows me, that eat before 7 and eat after 7 means before 7 p.m. and after 7 a.m. Every healthy human being should do a 12-hour water fast just on water. So there's nothing wrong. Go ahead and do it. And that shows that your body requires that much hours of food to come down under 100. So you're absolutely right. I would suggest eat before 7, eat after 7 a.m.
Got it, ma'am. So the next question is by Murari sir. So he's asking, is there any relation between age and sugar levels?
Yes, absolutely. Age has relation to everything. As we age, our hair become gray. As we age, our bones start to become weaker. As we age, our muscle mass reduces. As we age, our liver cells have aged too. So aging is a normal phenomenon. And that's how God made us. As we age, we have, but Now, as we age, remember that our muscle groups become less. We have much less muscle than we had before. And muscle is a very, very important organ for glucose metabolism. And so as we age, and if our muscle level in the body compared to fat is less, our glucose intolerance will happen as we age. So yes, you're right. Pancreas age, liver age, metabolism ages, and your sugar levels respond to that. Now, if someone was to keep their metabolism up, and how does somebody keep their metabolism up? People keep their metabolism up by basically exercising, thinking of how muscle is made, working towards muscle building and not just walking. And once you do that, and nowadays there are tests available which can actually exactly tell you what is your muscle mass. So they can tell you that how much is your skeletal muscle mass, which is very good for you, and how much is your fat around your organs called the visceral fat, and how much is your peripheral fat, and you can literally look at increasing your muscle mass. And even if you don't do that test, but if you were to lift 1.5 to 2.5 kg weights and do some bicep, tricep exercises every day carefully, no one's telling you to be dressed. You tie these TheraBands around your thighs and you try to walk sideways. All kinds of online, especially Sugarfit has tons of exercises which you can do when it's raining outside in your house. But it should be an attitude that I have to understand my body. Why is glucose metabolism worse as we age? Our muscle mass reduces, our liver ages, our pancreas. Now, what do we do to hold it in its place? What should be our actions? I think that is what we need to learn.
Thank you, ma'am. So, ma'am, we have another question which is on fasting, right? So, this is by Mr. Bharat. So, they're saying, can you please advise on my fasting sugar level? He has noticed that when his fasting time increases from 10 to 12 hours, his fasting sugar levels increases. So, he's asking, how can I address it?
He needs to check in the middle of the night around 3 a.m. if his sugars are too low. So sometimes, as I've always mentioned, that there are two ways that you're fasting. If you fast longer, your sugar levels go up. Somewhere body is sensing hypoglycemia or low sugars, at least the liver. You might be still at 80, but your liver is sensing a lowered sugar. And as a result of it, it's causing a phenomenon called neoglucogenesis, where your stored sugar, which is needed for your body's energy later on, is actually broken down by the liver and pumped into your blood. And that's called neoglucogenesis, and your sugar levels rise. So the best thing would be if you have a sensor, you can actually see night after night what your sugar does at 3 a.m. in the morning. And when is your liver sensing that? I have seen that, Shifa, that for different people is different. And when is that liver sensing low sugars? Your blood might show a 70 or a 75 or 80, but the liver might start pumping the glycogen into the breakdown of glycogen and glucose into the blood. And that's why you can have higher sugars if your fasting is longer. So find your sweet spot, check your sugar levels around 3 in the morning and see if they're too low, and work with your doctor.
So there's another question by Mr. Bharat itself. So he's asking, what is the right time to check your fasting sugar levels?
As soon as you wake up. So people keep asking me this question. Shiva, you asked me this question multiple times. So people say, suppose if you eat at 12 midnight and suppose you wake up at 6, that will not be called fasting, right? So at least 8 hours, we say, should be minimum. And otherwise, the first thing when you wake up, if it's been 8 hours plus, we call it fasting.
Got it, ma'am. So there is another question. This is by Miss Jayanta, right? So she's asking, does COVID have any relation with sugar and cholesterol?
COVID did not cause diabetes. Okay, this has been studied multiple times. It unmasked diabetes. So when COVID happened, the tendency of diabetes or pre-diabetes became diabetes because the body went through a lot of stress. And in a lot of cases in COVID, we gave people steroids very early. And what do steroids do? They increase sugar level. So when patients who never knew they were diabetic were suddenly 140 fasting and they felt COVID did it. The COVID or the coronavirus does not cause diabetes. And steroids also do not cause diabetes. They unmask the tendency of diabetes, which is already present in your body.
Got it, ma'am. So there is another question, which is on checking sugar levels, which I think we'll also cover today. But this is by Mr. Riju. He's asking, how frequently do we need to check our sugar levels?
Every day. Single answer. And I already covered that. But if you don't check every day, you're not accountable every day. When you're not accountable every day, your actions or your lifestyle does not help you in reversing diabetes. So if you have any intention where you want to get off medication or you want to reverse, the first thing you will do is check your sugars every single day and live that particular day on exactly as those sugar levels were. If the sugar levels was 100, live a decent, disciplined way. If your sugar levels were 140, make sure that you have more fiber, you have more protein, you have all kinds of healthy things, you exercise more. So make sure that you do that if in case your numbers are higher. So every single day.
Got it, ma'am. This is the next question is by Miss Promila. So she's asking, what does frequent urination indicate? So in case their KFT and LFT are all normal, what does it indicate?
It could also be a urinary tract infection. So if your sugar levels are under 150 fasting, or maybe even 175 fasting, it does not necessarily give you increased urination. The frequency of urination comes when sugar levels cross 200 random or 250 random. If your LFT and KFT have no relation to urine, LFT is liver function test. It has no relation whatsoever to your urination. KFT is kidney function test. And again, frequency of urination is not related to kidney function until and unless people have end stage or moderately severe kidney failure. Then the frequency becomes lesser and lesser. But frequent urination can be an aspect of anxiety, drinking too much water in the nighttime after evening hours. And then people wake up all night because they have taken water too much in the evening. And could be also, if there's a burning urination, it could also be a urinary tract infection.
Got it, ma'am. So the next question is by Miss Kavita. So she's asking, can you brief about C-peptide?
Good question. C-peptide is the beta cells function. So pancreas has beta cells that secretes insulin. And the measure of C-peptide tells you the function of the beta cells, right? You could easily ask me that why measuring insulin is not a factor of beta cell. And that is because in type 2 diabetes, the pancreatic beta cells are working to make too much insulin because we are not utilizing the insulin that is in our body very well. And we slowly become resistant to insulin. So there is actually too much insulin. And in type 1, there's a deficiency or insulin is not there. So C-peptide is a measure which actually very sensitively measures the amount of beta cells that are functioning in your body. You can do a fasting C-peptide and it'll tell me the health of your pancreas. If you do fasting and then you eat and 2 hours later, you do another C-peptide, it tells me how is your pancreas responding to the food you take. So I tell people if they want to just do fasting, that's fine. If they want to do fasting in 2 hours after a meal, I really like to see that also, because it actually tells me what is your beta cell doing to when you eat food. Are they responding well? So basically, pancreatic health function is measured by C-peptide.
Thank you, ma'am. So we have another question. This is by Mr. Rajesh, right? So he's someone who's recently been diagnosed, and he's 62 years old. So he's asking, what are the precautions that he should be taking, and how can I control naturally?
राजेश जी, सबसे जरूरी तो ये जानना है कि आपका नंबर क्या है. अगर आपका नंबर 8% से ऊपर है तो मेरा कहना मानिए 3 महीने अपने डॉक्टर की एडवाइस लेके उस नंबर को कम करिए, क्योंकि मेडिकेशन लेके, क्योंकि पैनक्रियास थक जाती हैं और दे गेट टायर्ड if you have a high number and you are actually defeating the whole purpose. आपको अपनी बीटा सेल्स हेल्दी चाहिए, पर आप 8% A1C दे के उसको टायर्ड कर रहे हो, तो आगे जाके तो दवाइयां लेनी ही पड़ेगी, क्योंकि हम खुद ही बीटा सेल्स को हेल्दी नहीं कर रहे. While if we were to just a minute, I'll just hold on. Sorry. So my thing, Mr. Rajesh, is that even we would not like you to take medication. If you're 7.5 and below and you're new onset diabetes, very high chance while lifestyle modification 3 mahine mein, you can probably get your sugars under control, provided you work on your lifestyle. Precaution to pata nahi, I don't know what to say about precaution, but what you need to do is to live a particular lifestyle, a disciplined lifestyle. So if you stay till the end of the program, please do watch my 6 steps, which I tell people to do. I think guidance is very important at this stage. Understanding your body for not now, for 30 years from now, 50 years from now, what really is my body? How does metabolism function? How do I understand how each food affects my body? How I understand every kind of exercise that works for me? And then I devise, okay, now I'm diabetic. How do I prevent myself to take medications ever? What do I do in my 24 hours? Which habits are essential for me that I learn them and I decide on, or that this is how I am going to get my diabetes managed. So very well, if you, depending on your number, I don't know how your diabetes, but please get either into a program like this to get yourself into an understanding for 12 months and your habits, or please follow me on like India Talks and try and do those 6 steps as much as you can and ingrain them in your lifestyle. And I promise that you probably not need medication.
So now we have an interesting question, which is by Mr. Shrikant. So he's asking, if you are someone with diabetes, can you donate blood?
Sure, you can. But your liver and kidney should be fine and your hemoglobin should be a good amount. So yes, you can.
Got it. So we have another question, ma'am, and they're asking, so basically they're saying, I'm overweight. Will losing weight help reduce sugar?
Absolutely. There is a direct correlation between weight loss and metabolic energy or metabolism getting kicked, insulin levels falling. Once the insulin levels fall, your sugar controls are much better.
So, ma'am, this is by Mr. Sudeep, right? So he has a frequent dry mouth in spite of his sugar levels being in range. So, what does that indicate?
That does not indicate anything. So you can check an ENT or dentist, salivary glands. If your saliva is not being formed up, you can put some aniseed in your mouth, or you can have a mouth freshener and generate saliva, because what you're lacking is saliva. There are many times, nothing to do with diabetes. I see people lack of saliva has a lot of medical conditions that need to be checked through a blood test. So I would suggest you see your doctor, and a lot of time people with very high sugar say that their mouth is dry. but there is no significant correlation, Shifa. I've had patients with 400 sugars never complaining of dry mouth, and people with 110 sugars complaining of dry mouth. I think it is a combination of how active your salivary glands are. What is the issue, ENT or dental wise? Are you drinking enough water? There are many factors. And I think a very easy solution, I feel that, is that, soft or aniseed, which has not got calories but fiber, chewing on that really helps to generate saliva. And non-sugarated mouth fresheners can really help you also generate the saliva and drinking enough water.
So the next question is by Mr. Jaswant, right? And I think it's the question which comes every single time. And they're asking basically, how can I increase my weight and muscles?
Yeah, very good idea. I love this question, Shifa. And it's a rare problem in India. Most of the time, as our population, we tend to need to lose weight. But there are cases where people are feeling that they have become too thin, or while they are correcting their diabetes and losing weight, they're losing all that excess fat that kept their face nice and chubby and their arms nice and chubby, but it was all fat. So when we are reversing diabetes, that fat has to disappear. And then the skin starts to hang, and everybody's very worried about too much weight loss. Families start saying, "Arey, aap kaise lag rahe ho?" There's a lot of things that happen, but the person gets very nervous and starts to eat, and we see that wrong things, and right away their sugars become higher again. So let's assume that you are a person who has low weight and less muscle. So my suggestion to you would be a diet which is higher in protein, if your kidneys are fine, a lot of fiber, and some amount of complex carbohydrate, and a lot of muscle building workouts. And muscle building workout is strength and conditioning, which is basically you can work with TheraBands and do planks and do all kinds of things which make you strength and conditioning, but and doing weights. But I would tell you absolutely to stop all aerobic exercise, which would be running, skipping, swimming, brisk walking. All of that makes you lose weight. But if you are not wanting to, you wanting to gain weight, you have to stop all of that. And you have to do very smart exercise. You have to exercise every day, but you have to do it with weights, with TheraBands, with your own body weight, like a plank. And you have to do abs to flatten that stomach and build stomach muscles, and eat a diet which is high in protein.
So, Mom, we have another question, right? Which is again quite similar to the previous one, but they're asking, is there any ideal time for muscle building exercises? Should it be before meals or after meals, or any ideal time? Is it there?
No, go ahead and do it. I mean, Shifa, they say that for yoga, you need to have the empty stomach and all of that, right? But for muscle building, we really don't have, I really don't believe in it. You should take something definitely very small. You can have nuts and, some water or half an apple. That'll give you the energy, because you do need energy. And sometimes I tell a small banana, something that'll give you the energy to do that workout. But I have patients who are doing it post dinner an hour later, but because they didn't get time all day, they're doing their weights and they're pumping their things, and they're fine. They're doing very well.
So I think we'll move on to the next question, which is basically they are saying that they heard about type 1.5 from your video. Can you elaborate a bit on this? And how do we know if we have type 1.5?
Yeah, so type 1.5 is the other name for that is adult onset type 1. Means type 1 जो adults में होती है. Usually type 1 is for under 12 years of age. But there is type 1 in people older than 20, 25, even 30. So what happens basically in type 1 is there's a destruction of your beta cells of your pancreas, which actually cause when the destruction of your beta cells, which actually happens due to some autoimmune antibody which destroyed your pancreas. Now, sometimes this autoimmune phenomenon is actually happening later, and it happens in 20s or 25 or 30, and it causes destruction of the beta cells. You just don't have beta cell function. I checked that by doing a C-peptide level, and the C-peptide level comes on to be very low, which proves that you have type 1.5. There are two kinds of type 1.5. One is called latent autoimmune diabetes of an adult, which is basically autoimmune destruction of beta cells at an old. And then that's when I do a couple of antibody levels. Sometimes I get them positive, sometimes I get them negative, but the C-peptide is not there, which is telling me beta cells are not working. Now, the other one is called mature onset diabetes of the young, which is actually a chromosomal dislocation, or we call it chromosomal mutation, you can call it, which is genetic, very much genetic. And in those people, I see that they can respond to medication for about 8 to 10 years. And the medication balances them. So they do have some beta cell function left. But about 8 to 10 years into their science, how do I diagnose people with this? Is I'll see a person who says at 40 that I was diagnosed 12 years earlier. And the most important factor for both of them tend to be that they are usually underweight. So their BMIs are very low and they're totally distressed. They don't know how to manage their sugars. They've taken multiple medicines to 4 or 5 doctors, and the sugars are not controlled. And they come to the program, and then I look at their history, their symptoms, and I do a C-peptide, and then I have a discussion with them.
Got it, ma'am. So we have another question. This is by Mr. Kranti. So he's asking that I understand muscle building is important, but why is it important? How can it help in reducing sugar levels?
So Mr. Kranti might not have been in the early part of my talk today, but I did talk about why muscle as an organ is the first organ in your body that absorbs or sucks up the sugar from the blood. So aap khate hain meetha. And if a person is a muscled person, that person's sugar level would be much lower than yours at 1 hour later, because that they have this very powerful organ well developed in their bodies, which is the muscle part of their body. And as a result of it, they will suck up that sugar from your blood and your blood sugar levels will go down. So I hope this answers your question. It's a very simple answer, but you can't ever, any of you, have to all understand that you cannot take away the role of muscle. The most important role for sugar control is how much muscle you have.
So, ma'am, another question. This is by Mr. Kakoli. They're asking, is it possible that type 2 converts to type 1? How and how can we prevent it?
Very, very good question, Mr. Kakoli. I really think that this is a very relevant question, especially in our country. So, type 2 for a long time, uncontrolled, what will it do? Sugar levels will be high. And what will the sugar levels do? They will go and overwhelm the pancreas. The pancreas will not be able to function because the sugar levels are just sitting there and exhausting those beta cells till they die. So what do we do with our uncontrolled diabetes, uncontrolled high sugars? We have generated a beta cell destruction ourselves. And as a result of it, beta cells, when we do a C-peptide on these people, it is less than 0.7, and they've become type 1. This is the first part of your question, that can that happen? It does happen. How do you prevent is all my answers together. Follow the 6 steps, live a lifestyle by which your sugar levels are under control. Every single thing here is in your control. You are letting it not get under control. Every single sugar level is in your control. The mind has to control its instincts of eating wrong things, exercising daily, feeling young, energetic. And I promise you that you will not turn into type 1 if you were to take care of that. So there is no autoimmune destruction happening from anything. It is only our sugar levels, which have been high over the years, have overwhelmed and destroyed the pancreatic beta cells, because the beta cell says, now I can't make any more insulin. I'm tired and I'm exhausted and I'm gone.
So, ma'am, the next question. Okay, Mr. Kakoli, he's asking for the 6 steps. So, please stay tuned, sir. We'll be going over the 6 steps after the Q&A. So, please stay tuned. Right. So, the next question is by Mr. Sudeep, right? So, he's asking, does cinnamon water really help in blocking cravings for sweets? Or maybe we can also talk about just cravings in general and, how to, overcome that.
So, Sudeepji, there are all kinds of theories. Cinnamon is very beneficial for you. It's a known substance which is given to cardiac, blood pressure, sugar. It is in general a very, very good spice to have. There's nothing wrong with it. Regarding cravings, I don't know if it uses cravings. Basically, I have realized that cravings are reduced by taking more substantial food. What is substantial food? Food that keeps you full for longer time. If you take food that exists your stomach right away, gets absorbed in the blood, your empty stomach again, your craving goes. But if you have food that stays in your gut for longer and your stomach doesn't empty that fast, that food will help you not have craving. Now, what is that food? Fiber, protein, carb, and even carb, which is complex carb, which is millet, which is full of fiber. That does not exit your gut very easily, keeps you full till later, and you obviously lose the cravings. Second thing which causes cravings is when you are not sleeping very well. So I tell people that if you do not have regular sleep of uninterrupted of 7 to 8 hours, and you don't sleep at the right time, that which is between 10 p.m. to 6 a.m., if you are not able to do that, your cravings will become crazy next day because of all the cortisol and the hormones that didn't get satiated. So our brain secretes hormones that give us satiation, and there is another hormone which causes hunger or craving. When we don't sleep well, the hormone ghrelin that causes hunger craving is higher, while the satiating hormone called the leptin is less. So it's very scientific. Sleeping very well, eating small meals, but very dense meals, proteinaceous meals, high fiber meals takes away our cravings. And exercising secretes. So when we do exercises, there is endorphins, we all know, that come out. They're called happy hormones. But every time you exercise, your satiety hormone called leptin goes up, and your hunger craving hormone called ghrelin goes down. So it all comes down to the same. All these 6 steps that I practice and I preach, they all come from this science, which is about this satiating hormone or the craving hormone. And I hope you will also follow the steps.
Ma'am, yes. So, ma'am, there's another question, right? So, this is by Aloka, ma'am. She's asking, is diabetes reversal permanent?
It's not cure. It is reversal. You're reversing and finding your way back to a non-diabetic state without medication. But the minute you let go of your lifestyle, because your body has glucose intolerance, diabetes will show up again. It is basically a way of life that you're learning by which you do not need to take medication and go back to your diabetic level. And it is the way of life of every single day. And that is why I keep repeating, this is what you become. There is a cure of diabetes would be basically reduction of body weight if somebody has an access to an ideal body weight of 22, plus a pancreas which is healthy and vibrant, which needs to come from outside, because nobody is giving you pancreas. Everybody is giving you a lifestyle by which you can reduce the weight if you have excess weight, or build up muscle if you need to get muscled, and live a lifestyle which will not let you take medications. Actually, I always tell everybody, Shifa, when they come to my office, that aap ye dawai kyun le rahe ho? Why are you taking these medicines? because you decide, I'm not going to live that lifestyle. So I'm going to take this medicine because the demand is that living a great lifestyle. But I am going to take medication, find an easier way out. And then I don't want to take medicine also comes very soon. Because how many medicines will somebody take? 1, 2, 3, 4, 5. Then they come to a point that I don't want to take. By that time, it's too late. You have generated 5 different medications. Okay, you can still bring it down to 2 medications. But remember, reversal is getting to a number without medication or only on metformin and staying there by your sustainable lifestyle throughout your life. It is not a cure. So I really request people, whoever wants joins our program, and I talk to the new joinees, I tell them that please don't get into a system just because you think that there is a magic wand or a solution. Get into the system knowing that there will be certain ways to be adopted. There will be certain changes and reflections on my own learnings over the years and how open am I to learn what is right for my body. With these 3 thoughts, you need to come into a program and you will benefit because you're coming like a clean slate and you say, you know what, I need to get rid of these medications. And I'm telling you, many have done that. And that is how this is designed. But it is designed, it is not doing it for you. You will do it for yourself. We will share our design with you. And I promise if you stay with the design, you will be able to get to a point where you're not on any medicines.
So I think now we can take one last question before we, go for the 6 steps, right? So again, the question is again by Mr. Kranti. He's saying that he finds it very difficult to sleep. Is there anything that I can do to help? And he also heard that magnesium is helpful. Is it true?
Absolutely. I have actually given a talk on magnesium recently, and magnesium is extremely useful. So I please follow our channel, and I have actually recorded something very about a 5-minute talk on just magnesium about 3-4 days back, and I think we are going to release that very soon. And I've also spoken on Instagram on magnesium because I really believe that magnesium is a vital mineral that we don't realize how it affects our body in not one way. There are multiple ways. Magnesium helps, of course, sugar metabolism. Magnesium relaxes the muscles and also gives us great sleep because it generates relaxation. It helps secretion of the right hormones for sleep induction and relaxation. It causes the rhythm of the heart very in control because it causes the the movement of sodium and potassium in the muscle in the right manner so that you get the right contraction and relaxation phase of your muscles. It is also mood elevator, Shifa. So it actually helps generation of serotonin, and it helps in neurotransmitter regenerations. And as a result of it, you can actually feel at a better mood if you take magnesium. You have a more calming effect on yourself. Your bone mass, of course, improves because magnesium is amazing for absorption and movement of calcium into bone. So magnesium is amazingly good, and especially helping your sleep and if you have any muscle cramps or anything. So I would suggest most people to take magnesium. I always like to give magnesium. It also helps in reducing your cravings, Shifa. So it's a very great supplement. There are certain cases, please look for my video, which talks more about magnesium for 5 minutes. Certain kinds of people who can't take it, or certain kind of people who can take it. I've sort of really brought it out, ki kisko lena chahiye, kisko nahi lena chahiye, who has to be careful, who has to take advice and from their doctor and take it. So watch out. I have spoken a lot on magnesium, but in short, I can tell you that it will help your sleep. And if it's safe for you, watch my video. Please take it. Another thing that you need to do with our sleep is that on our community groups, if you're on Sugarfit, we do a very nice 9 p.m. Yoga Nidra community session. And I have had such good feedbacks come through it, Shifa. In fact, people sleep on that program. They're sleeping. So they go fast asleep while that Yoga Nidra session is going on. So I know if you're not familiar with the online sessions, but our Yoga Nidra at 9 o'clock is extremely good. And if you are a member, don't miss that, and that will help you sleep very well. Yeah.
Got it. Thank you so much, ma'am. I think we covered most of the topics and questions today, right? So I'll just quickly go ahead, share my screen so we can get started with the 6 steps.
There was a question about joining the program. Shifa, you might want to put a message out there.
Yes, yes. Viju sir, what you can do is you can just leave your contact number in the chat. We'll reach out to you and help you.
So the 6 steps of staying reversed or diabetes is number 1 is about checking your sugars daily. I had a long question and I answered about that. Make sure you check your sugars every single day so you can correct your sugar levels every single day. And it'll definitely help you control, stay reversed forever, never to take a medication, provided you correct your sugar every single day in your life, looking at your fasting sugar. The second step of the 6 steps is having salads before each meal. So we call it meal sequencing in Sugarfit terms. We always want our patients for all 3 meals to have a bowl of salad, whatever is available, which is raw in the house, cucumber, carrots, tomatoes. Make sure you cut them, sprouts, whatever you have. Before 10 minutes before a meal, line your stomach with salad. It prevents spikes and also cravings are reduced and hunger is reduced. So make sure the meal sequencing is followed very well. The third step is basically sleeping very well. So I tell people 7 to 8 hours of uninterrupted sleep in the right time zones, not the wrong time zones. So what's the right time zone? 10 to 6 or 11 to 7. Very important for you to definitely make sure that you are able to sleep in the right time. Try and have your liquids before 5 p.m., your caffeine before 5 p.m., so that you can have an uninterrupted sleep and not too much water, except for the medications you take at late at night. Step 4 is circadian rhythm. So what I tell is that every cell of your body, it could be any cell in any organ, it follows the sunlight and the sunset. And that rhythm of 12 hours is called circadian rhythm. So the right hormones, again, we've said satiety hormone, craving hormones, melatonin, growth hormone. You should know that they follow the circadian rhythm and they respond to sunlight. So my suggestion to everybody is that make sure that you sleep on the right time, and after darkness, try not to eat anything heavy. Have something light if you have to, but try to eat before 7 p.m. and eat after 7 a.m. So eat in 7 a.m. to 7 p.m., which is your ideal time for your circadian rhythm to get food and the right absorption, the right nutrition for the body. So remember to please not eat late at night. It is terrible for your body. Step 1, Mr. Kakoli, is checking your sugar levels every single day. Step 5, exercise regularly. So make sure you do a combination. If you like to walk, I won't stop you. That is besides the point. You walk, and I won't consider that an exercise. So 6,000 to 8,000 steps, everybody should walk if they can. I'm not talking about people who can't walk. But then there is, of course, strength and conditioning. Then there is, of course, muscle building. Then there is, of course, Pilates. Then there is yoga. You can have people like swimming, people like cycling, people like skipping. Talk to the expert that you have around you, according to your BMI, according to your age, what kind of combination workout so that muscle building happens to your body. Step 6, and I believe that that's one of the most important to be able to achieve what you have achieved. Meditation and mindfulness is the most important part. So my suggestion to you would be to make sure that you spend at least 10 minutes in meditation or 15 minutes in meditation. Meditation is not breathing. Meditation is not yoga. Meditation is sitting in silence. Meditation is absolutely letting the silence or cleaning happen to you for impressions of the day. It gives you the power to make right choices. It gives you mindfulness. It really gives you the strength to stay calm in the most stressful situation. And all of that helps sugar. It also gives you that strength not to take the second gulab jamun or the second rasgulla. It gives you that strength. You are in control of every faculty. Just like how we say that if you have to learn music, you have to do riyaz every day. You please remember that it's very, very important that you need to do meditation and mindfulness. So I would want you to work at this and master these 6 steps. Just knowing that this is my goal and I need to do these 6 steps are very important. Start at any point, it will help you. I promise that all of our lives, everything will improve if we were able to definitely make sure that we are following at least 6 steps in our daily discipline.
Yeah, thank you so much, Ma'am. I think everyone was waiting very much eagerly for the 6 steps. And now that we have covered it, like we have done our part. So I think the next thing is, the audience, they are the ones who need to start following the 6 steps. So I can see we have almost 154 people on call right now, right? So I want to encourage all of you to join in next session as well and let us know what step you have, started implementing into your routine or into your, daily life. Because Dr. Chhavi said, I think, it's very important to, follow these 6 steps. So definitely we would love to see all of you next session as well, which is on next Tuesday. Yes,
I have a question to ask you. How many of these steps are you following?
So, ma'am, obviously not the first one and not the last one, because meditation, I think for me, sitting and in silence, my mind just wanders. I have started following the circadian rhythm. So I, eat early, sleep early. That's been really helpful for me. And eating like salads also. I've not been able to do it before every meal, but I try to take it at least once a day. Then obviously I have started with yoga. So that is something which I, like doing. So I think 3 I have started, except for the mindfulness and the first one.
So, Shifa, just for example to everybody, that's where I want you to make sure you have salad up before each meal and you master that habit. You do a combination of workout, which is muscle building and also strength and conditioning. Yoga is great, but other things also have to come in picture. You meditation is nothing but just play music and don't talk. Just sit with your eyes closed and let the mind wander. Watch it. Watch that mind. What is this naughty mind doing? That's another spirit. So those are the things that I believe everybody should do. And I think I just am sharing a little glimpse of my own life, and people who know me around actually really know that this is what I built up my entire life on, and I'm sure that all of you can, and you will do it. So trust me, these 6 steps really work.
Yes, thank you so much, ma'am. I think we are, eagerly waiting for all of you to join next session as well. Hope all of you found this session really helpful. Thank you so much for joining.
I would like to mention to people who have regularly joined that I am in the United States for 4 weeks. And I will be doing on Tuesdays India Talks, but the time might have to move an hour. So we might actually move it to 7:30 to 8:30. We will keep you guys informed. And I get up in the morning there and I'll take the India Talks. I will not miss India Talks.
Sure, ma'am. Thank you so much. We'll definitely, meet next week. Thank you so much, ma'am, for joining and taking, an hour of your week every single week with us and, just motivating and inspiring, so many people. Thank you so much.
Bye, everyone. Have a good evening, and I'll see you next Tuesday. Bye, Shifa. Thank you.
Yeah. Bye, ma'am. Take care.